I want to bring in my guest in studio. I'm joined by Michal Shraga Slonim, a HeartMath certified resilience trainer and the head of the Integrative Healthcare and Medical Care Rehabilitation Hospital. Thank you so much, Michal, for joining us.
Hi.
Let's talk a little bit about the work that you have been doing for the past month now, really helping a lot of the people who need mental health right now more than ever.
Right. So basically, Nicole, all of Israel right now is traumatized, but the severe trauma really lies within the people that were deported from the Gaza Strip and the people that are coming from the settlements that were really hurt, and many people were, killed and murdered and slaughtered. So these people that have seen these horrific sights, they're the one who've suffered the most. And as you know, they're all in a lot of hotels in the center of Israel, in Tel Aviv area and in other places, in Bat Yam, where our integrative hospital is situated. And so we have teams of volunteers and teams of experts in trauma release, and we're doing a lot of work with them.
I'm curious, your teams right now, they're dealing with some of the most traumatic experiences these people have ever dealt with in their life. How are your healthcare professionals doing? This is also taking a toll on them.
Exactly. And it's very, very true. I think we are all suffering of secondary trauma. And so we have resilience courses, and we have a lot of little techniques that we support all of our professionals and all of our teams in the area, so that on an everyday basis, they can take care of their mental health, of their physical health, and, not get accumulated by all of this horrific things that they hear about every day.
What are some of those tips? What would you recommend to people right now?
So right now, it's very important to release the energy, and I think that even people who just watch TV and, just see it from far away, even if they're not in touch with the people who were hurt, they suffer from secondary trauma. So some of the tips that I can give you have to do with breathing, and when we breathe, we actually let our autonomic nervous system know that we are okay. It's like letting it know that the tiger has left the room, that we can go out of the shelter. So deep breaths that we take into our lower abdomen, and we count 5 inhale, 5 exhale, and this way the autonomic nervous system gets out of the shock and out of the trauma that it's locked down in, and it can relax, and it can, just function on an ordinary basis. So I think breathing is the first thing, because it's something that we do anyway. You don't need to take a break to breathe. You do it anyway, and you can do it anywhere, even when you run to the shelter. So it's something that everybody can handle, the breathing. But we have other grounding techniques, and I can teach you if you want to. Yeah, okay. So we're both sitting on a chair. One of the grounding techniques, when you're like in panic, when you feel, oh, I'm shaky and I can't think straight, you can just press your legs down to the floor, and with our hands we make a butterfly hug. Okay, so we press the legs down to the floor. That's a grounding process, and we tap. And the tapping is kind of like caressing. It's kind of touching. It gives us a little bit of a warmth. It feels like a child who's carried in his mother's arms, right? A lot of associations that give you warmth. And actually, when someone is panicking in a shelter room, or there's missiles going over your head and you're outside because you were driving, if you do this, it really soothes the body, and you start going back to yourself. So it kind of brings us back to the neocortex, which is where we process everything and where our everyday thinking happens. But when we are in shock or in trauma, we kind of shut it down, the neocortex, and we think from our reptile brain. So when we do the grounding methods, and it was pretty easy, right?
And it was very calming also.
Right. So what it does, it actually tells your neocortex, I'm okay, you can start processing reality in a normal way again. So it's a very good way to do it.
So would you recommend for people throughout all of Israel, even central Israel, as we were hearing from our correspondent Robert Swift, there seems to be a nightly barrage of rockets almost, so thousands of people around the country are running to their bomb shelters every night. Is this something that they should implement while in their shelter?
I think that everybody needs to start taking responsibility of the breathing. The breathing is the most important tool that we have, and what we need to understand, when I see the refugees that are coming on now from the south, from the Gaza Strip, they're all breathing very shallow. They're breathing up to here. and you can see that the body is a little bit, like bent over, and there's not enough air coming into the other organs. So just remember one rule. I'll give this is the heart math technique. Heart math is it's a very known institute in the United States, and we are all learning from them because everything that they teach is actually proven scientifically. So scientifically, we know today that when you breathe, you inhale for 5 seconds and exhale for 5 seconds, and you do it in a way where the inhale and the exhale are the same length, it actually lets your nervous system know that you're fine and that you're not in danger. So you can do this while you're in the shelter, you can do this when you're running to the shelter, and you can also do this afterwards when you go to sleep and you're in bed, to release all of that energy that's stuck in your body because of all the trauma and the tension and running and the scariness, and just go to sleep when you've already let it out. Because what makes people, and this is important to know, stay in PTSD. PTSD is when we're stuck with all this energy in the body, even when everything is already over. And then it really disturbs our everyday functioning. So if we don't want us, the whole country and us personally, we should do this individually and also collectively, to be in all those symptoms later on, then just use the breathing and also the grounding technique of just putting your hands on your lap or like this, and just pressing your feet towards the ground and grounding yourself, feeling that you're safe, because the ground gives us a safe feeling.
Well, these grounding techniques certainly help for the general population, especially in these very tense times. I'm wondering when it becomes more and when people might need actual medical attention. We saw a report that the demand for prescription and over-the-counter psychiatric medications has jumped by 20 to 30% just in the past month. So how do you tackle between knowing when you can handle this yourself with some grounding techniques or when you do need some medical help?
This is such an important question, Nicole, because it's a horrific number, the amount of people who need now this support. And what I want to say about that is that when you really need the support of pills, it's very, very good to do it and to take it because you're in severe trauma. But what the pills do is they solve nothing. They actually bring you to the 0 point. And when you're in the 0 point, now you can take the treatment. Now you can really have a discussion with a professional therapist and help yourself release the trauma, because the pill will never take care of the trauma itself. It just takes care of the symptoms. So both are very important. First, take the pill, go to I call it the 0 level, where you can actually have a real conversation and you're not in severe panic or hysteria, and then you can treat yourself. And I think that the long-term treatment is very much needed with people who have suffered trauma. And never think that the pill is enough. You really need to release this out of your system. Otherwise, what we find as professionals is that it affects all your relationships in life. It doesn't go anywhere. It's just buried, and it will come up one day, and it's a shame.
So all the work that you and your team are doing, it's helping tackle this trauma, and it's so important right now. Michal, Shraga, Slonim, thank you for everything you're doing and giving our viewers some tips to ground themselves right now during this tense time. Thank you.
Thank you.